And so for this procedure, you talked about doing it in the OR versus doing it in the office. Briefly talk to us a little bit about anesthesia protocol when you're doing it on an awake patient.
Yeah. So everyone has their own variation,
Yeah.
right? And so I always tell people, figure out what works for you and then do that, right? Because you'll have to copy what I do. So what I do is I'll first start with spray. So topical numbing, right? So I spray them with topical lidocaine and topical oxymetazoline. I then soak little cotton pledgets, those little rectangles with tails on them, in that lidocaine and oxymetazoline and put them in right where I'm going to do that nerve ablation, right? For a while, I used to do cotton balls. I actually really like cotton balls because they expand and they get like, they apply that topical in a 360 manner. While those pledgets are a little bit thin. But I had one patient who sniffed in a little bit too hard and ended up swallowing his cotton ball. Right. And so ever since then, I was like, okay, I'm just going to switch back to these pledgets.
No one gets cotton balls. They ruined it for everyone.
I know. It's a little bit, he got a little extra fiber in his diet, so.
That's funny.
Yeah. So I'll do that. So a couple of key things that I found. One of the most important things is I will anesthetize that nasal valve too, right? And so we're not doing anything to the nasal valve with this procedure, but a lot of our cameras, a lot of our instruments is passing in and out right next to that nasal valve. And so I've actually had patients complain about the camera pushing it against that valve more so than the instrumentation itself, right? So I do anesthetize that area so that way they're nice and numb.
Topically?
Just topically, yeah.
Okay.
Just for patient comfort.
There. Yeah,
exactly.
Okay. Cool.
And then I do still do injection. Now, there's a lot of people who don't do injections anymore for this procedure, but I still do because I think it does offer a little bit more anesthesia. I'll do a SPA block, right? And so I'll inject there and inject along that lateral wall, along the turbinates, along that septal swell body. The downside of that is you do get a little bleeding when you're injecting,
right?
Because otherwise it's pretty bloodless procedure. Mm-hmm. But I think for me, it seems to benefit my practice. Some other things to do that I do. This is how I practice in Southern California, right? I do a couple of like non-medicated anxiolytic practices, right? So when I have the patient come into the room and I'm talking to them about like the procedure, I actually have a lavender aromatherapy kind of going at the same time. There's a lot of good evidence out there that lavender aromatherapy seems to help with procedural anxiety and pain. And so while we're discussing, they'll be breathing in that lavender, hopefully calming them down a little bit. I'll do some music therapy as well. Right? And so I'll have some music playing in the background. So that way they have something to distract themselves, something to help ease their anxiety. And then I'll dim the lights.
Music?
I leave it up to the patient's choice, right? Whatever they feel relaxing, right? So some of them like spa, some of them like classical music, some of them like hard rock. Right?
I was going to say, I let a patient pick one time and he picked Metallica, which was not very relaxing for me trying to do a procedure on him.
Yeah, I had a patient pick 9 Inch Nails, right?
That's too funny.
But again, what we're treating is the patient, right? Not necessarily the physician,
it's
right?
Not about me.
Yeah, exactly. It's all about the patient right now, right? And so I think all these things kind of make it a little bit easier for the patient. So after implementing all these, it's been 3 years since the last time I've had to prescribe a oral anxiolytic for a patient.
Oh, really?
Right?
So you don't even do like a Valium or Triazolam or anything?
I used to, but by integrating some of these other things, patients seem to do fine without it. Yeah.
What was do you feel like it just makes them too sleepy, or it's not worth the risk, or you want them to be able to drive themselves, or what was the thought for moving away from it?
I just like to, I think in general, if we can avoid using anti-anxiolytics, that's always preferable. But the biggest one was the driving to and from the procedure, right? So if they did take the Valium or something like that, then obviously they would have to find a ride, which kind of goes in contrast of doing the in-office version, right? Because in-office procedure is all about convenience, and that makes it really inconvenient. Yeah.